Welcome to this new episode of KU Pulse, the podcast. My name is Sarah Bawazir. I'm a senior lab engineer at Khalifa University. Ladies and gentlemen, you know that this year, 2025, is the year of community in the United Arab Emirates. And the unit of a community is a family. Some people are having trouble starting a family due to infertility. Today, we have with us Professor Junaid Kashir, an associate professor at Khalifa University, who will help us understand infertility and talk about solutions that will give hope to all the couples that are facing these challenges. Dr. Kashir has over 20 years of experience in reproductive science and medicine. He completed his education and obtained his PhD from Oxford University. Dr. Kashir, welcome. We are glad to have this conversation with you today. To begin with, Doctor, can you please define fertility and infertility in the classical sense and also your own definition from your 20 years of experience?
So thank you so much again for having me here. It's a very emotive topic to talk about. So I think let's start at the beginning. How do most institutions classify the concept of infertility? So a couple is classified as infertile after they have attempted to conceive following regular unprotected intercourse for a certain amount of time. This amount of time differs depending upon which part of the world you're in, but generally it's about 2 to 3 years. Now, infertility in itself, let's try to tackle that monster first. It's a huge issue, what a lot of people don't realize, and for obvious reasons, where there are more people alive and on this planet at the moment than have ever been. But people don't actually realize just how widespread this issue is. The WHO classifies this as an actual condition since 2010. And these are a little bit old figures. They probably need a little bit of updating, but there's probably more in terms of magnitude. About 1 in 5 to 1 in 7 couples worldwide will be unable to conceive. They will not be able to have children following this definition, a specific time point of regular unprotected intercourse. So it's a huge number. More than that, though, males, 1 in 5 males, will specifically will be suffering from something called subfertility, which is not just infertility outright, but they will have major issues in conceiving. Now, if you want to try to understand what are the causative issues behind infertility, it very much depends on who you speak to. So if you speak to a clinician, or if you speak to, or if you read a medical textbook, then these will essentially tell you that it's 50-50, 50% female issues, 50% male issues. But really, that's a little bit misleading. If you speak to someone like myself, reproductive scientist, or even an embryologist working in fertility clinics, the answer given will be a little bit different. So if you break down the causative factors, now this is not to say that there's one leading factor over the other. It's just what the numbers are saying. There are major female concerns. There are female fertility issues and reproductive science and medicine issues, which are actually much more pervasive, much more physically draining, such as endometriosis and PCOS, and they deserve a lot of the attention that has been given to it because these are very challenging conditions. But generally speaking, if a female or a couple rather presents to a fertility clinic and we are able to obtain the female gamete, which is the oocyte, commonly referred to as the egg, then most likely there will not be a female issue. On the other side, male fertility has usually been just associated with production of the male gamete, which is production of sperm. So failure to do this was generally classified as infertility, and this is around about 26 to 30% of cases. However, if you then further try to classify what is causing infertility at the molecular level or even at the physiocellular level, there's a big chunk of the pie which is classified as something known as idiopathic or unknown infertility. And this is attributed to about 30 to 40% of infertile cases where both gametes are being produced, everything looks fine, but for some reason, we don't know why, fertilization or embryogenesis or implantation or pregnancy is unable to happen.
So, doctor, are you saying that more than half of the cases could be because of the male infertility?
No, absolutely. Yes. So, again, I'm a little bit biased. So, there's a bit of a disclaimer there because this is the area which I work in. But if you look at the data and you start to understand the sort of pictures that we're finding, actually, the sperm factor, the sperm causative factor seems to be much, much more pervasive compared to female. So, definitely, I would say, at least in my somewhat biased experience, the major causative factor, if you combine failure of spermatogenesis with potential reasons underlying this idiopathic chunk of the pie, male factor is definitely the leading cause behind infertility.
So, doctor, before we dive into the male factor, I want you to define some of the technical terms for our audience because, as we have agreed, we wanted this to be informative for couples who are facing issues. Give us the distinction between embryogenesis, fertilization. What are the differences?
So essentially, you have at the very basic level, you have gametogenesis, which is creation of the male and the female sex cells. On the female side, you have the oocyte or eggs, and of course, you have on the male side, you have the sperm. Now, the general idea is that you need to combine one of each to be able to produce a new individual, and the combination of these two gametes, these two cells, is something called fertilization. Once you have the egg and the sperm fertilizing, then this creates a zygote. So this is a very technical term, but really it's the embryo that has been generated. And from here on in, the single cell the zygote will start dividing, multiple cell divisions. That is a process known as embryogenesis. And then implantation is the term where the embryo at a certain developmental stage attaches to the endometrium in the uterus in its mother. And from there on in, then a pregnancy is established.
So, what leads to the failure of establishing pregnancy after fertilization?
So I think there's a lot of issues, and we don't have time to cover all of them, obviously. So I think what we should try to consider are the major issues that are there. For the first major issue, of course, is failure to generate the embryo. That's one of the major causes, where either you have a failure in gametogenesis, you have a failure in fertilization, or you have a failure or improper embryogenesis. So that's one side of the coin. The second side, of course, is also then implantation. So for reasons unknown, an embryo is made but is unable to implant into the uterus. Now, there's many reasons for that as well. There's endometrial issues. There could be hormonal issues. There could be many other epigenetic or dietary or lifestyle issues as well. But I think to further narrow it down, I think we need to also speak about assisted reproductive technologies, or more commonly known as IVF, in vitro fertilization. So just to give you an idea of what IVF is essentially it's obtaining both of the gametes outside of the body and then combining them in vitro or in a dish. So there are multiple techniques that are used to use this. There's a normal routine where you basically mix the sperm with the egg and hopefully one fertilizes, that generates an embryo. That's known commonly as IVF. But there are also many more powerful techniques as well. There's something called ICSI, which is intracytoplasmic sperm injection, where a single sperm is injected directly into the oocyte. And this rectifies a whole range of issues with the sperm. And I'll break down what major issues there are with the sperm as well and how sperm is classified in the clinic. There are also many other powerful techniques where we can take a single cell, it's called a single cell biopsy, from an embryo, and we can perform genetic diagnoses on that embryo for genetic disease, for various other types of rare conditions as well. So there's a whole range of very powerful techniques that are employed under this vast umbrella. I prefer to call it assisted reproductive technologies, or ART. And it's really widely used. So just to give you an idea, that about 70 to 80% of infertile conditions can be treated by this technique. It's just anyone in Abu Dhabi or in Dubai can just drive around the city, and around every other corner, one will see a new private fertility clinic opening up a new branch. So that gives you an idea. People are opening up shop because there's a lot of demand.
Yeah.
And in some Western countries, IVF and ART is so widely used that it actually accounts for about 20 to 30% of the total birth rate of that country. So just imagine that for a minute, that 20 to 30% of an entire country began in a lab. So that's how widely used ART is. But its success story is a little bit misleading in itself as well. Yes, it's powerful. Yes, it's space age cool technology. Yes, we can treat about 70% of infertile cases, so there's definitely hope. The issue is that per treatment cycle, it's not very successful, which a lot of people don't realize. It's not some sort of magic silver bullet. In terms of pregnancy success, one round of IVF, and I'll go into what one round involves, is only about 20 to 30% success rate.
So, Doctor, let's pause a little bit
Yes.
because there are like a few things we want to unpack. First of all, why are we or globally relying on IVF? Uh, is the issue of infertility rising, or what is going on? Is lifestyle affecting fertility? Can you please
It's a
unpack this for
very
us?
complex issue, and the answer is not very straightforward, but the outcome is very clear. So the answer to that is all of the above. There are many things which are impacting this. Of course, the one obvious thing is lifestyle choices. A lot of people are leaving having children too much longer, either for various issues. I'm not going to go into these issues. Everyone has their own reasons, but that is also increasing the reliance on ART. But it's again not so straightforward. That's only the most obvious reason. It's definitely not the predominant reason. There are various causes of infertility that we talked about, but there's many things that are coming about that we're actually appreciating now. Environment has a huge effect. Diet as well, that seems to have a huge effect as well, and not just diets have an effect on fertility. A lot of studies have actually shown that the parent's diet impacts the offspring as well, and further generations to come. So there's a huge side that we're only just beginning to understand as well. But to put it into perspective, and this is again why I point that really shine the light on male infertility. There are a number of studies now